Hey, welcome. It's Dr. Shiller. So, checking in a bit about the Movement Towards Health program with some questions and answers. First of all, enrollment's happening now, going for another several days into the middle of next week. We've got a great core group. I'm very excited about it. This is going to be an amazing program. And so, listen up if you're potentially interested. A couple of questions that have sort of repeated themselves are things like, well, tell me about the format of this class. Like, when I join it, is all the material going to be there, or is it going to be added to and grow over time? And then the related question is, well, how long does the course last for? How long is this program? And so I want to put those answers in the context of what it means to help people live better and feel better with chronic pain, because that's what this program is really about, is empowering people with chronic pain and chronic illness to feel better and to live better. And those are two aspects. One aspect is the actual degree of pain, disease, impairment, difficulty sleeping, the symptoms that a person has. And the second is, well, like, how is my quality of life despite all that? Am I involved? Am I engaged? Am I doing stuff that's meaningful? Do I feel like I'm living with purpose? Or am I just sort of like suffering and waiting till I get disabled and miserable? And so this program is about both of those. So let's talk about the first thing, about actually what does it mean to treat pain and chronic illness. I think I've spoken about this in a number of different places, but I see there being 3 M's after like working with tons of people over a couple of decades. There's kind of your metabolic biochemical picture. There's your motor or movement system. And then there's your mind-body system. And those are 3 aspects of who you are that are completely interconnected. You're really one unit, but those are like 3 handles. And those are 3 really important things to address, because chronic pain and chronic illness, living well with them is a truly holistic process. And so let's quickly think about the metabolic biochemical part. That's really about medications, nutrition, supplements. What are you doing to reduce inflammation, heal your gut, deal with whatever toxicity or hormonal stuff might be going on, all the biochemical stuff that relates to chronic pain and illness. That's not mainly what this course is about, what this program is about, although it could be over time. What we're really addressing in Movement Towards Health is the mind-body and the movement and the motor system of your body. And those 2 are so incredibly important because, just simply put, if you're living in a stressed out, distressed, miserable state of mind and emotion, that's toxic. And it's not only going to worsen your pain and chronic illness, but it's going to potentially prevent you from engaging in living fully. And so there's healing that can happen there for everybody. And we do it through various kinds of meditation, visual imagery, and certain mindset exercises that are really all about helping people stay in the game, get up in the morning, go do what they have to do to live well despite the challenges. And then there's the motor, the movement system. And that's really your muscles, bones, joints, nerves. And we address that through what I would call enlightened mind-body, mindful movement that's drawn from a few different systems. And the point of that is maximizing your body's ability to function and helping the body well, let me back up. So like, if you have an injury or a trauma, or if you have fibromyalgia, or you've had a surgery where things have kind of gotten out of whack and didn't go so well, the body reacts to that. Even emotional trauma, the body reacts to that. There's patterns of restriction of muscle, of connective tissue, of regional parts of the body that might get into biomechanic difficulty, shifts in reflexes. And we're about retraining that and actually reestablishing healthy movement patterns. And so the work that we do in the program is about optimizing the mind-body picture and the movement and motor system picture. And that has an impact in the short term in terms of helping people feel better, but it's got an impact in the long term in terms of helping you actually live well, regardless of what degree of symptomatology you might be suffering from. Because in my experience over and over again, what happens is the person like goes through a rehab after an injury. Maybe they'll do 4, 6, or 8, or 12 weeks of physical therapy, or maybe multidisciplinary rehab, and get to a certain level, or they plateaued, but then they stop, and then they kind of like lose their gains, and things get worse over time. And that applies both to their symptoms and their function. And so this is meant to be an affordable longitudinal program for those people who want to keep working longitudinally. For those who want to come in and work and benefit from all the training and the curriculum and the group support and the guidance that I provide and inspiration and all of that, it could be really beneficial for 4, 6, 8, 12 weeks, a few months or something like that. And some people are going to want to continue to maintain those gains or continue to build. I recently heard from one of the participants who signed up, I was doing physical therapy, but then Medicare cut me off, and I kind of got to a plateau and I couldn't get any further, and now I'm sort of slipping back. And so this is about addressing that and giving this person a place to go to maintain the proper mindset, to maintain mind-body skills, to heal more deeply if that's what's up for them and that's what they're open to, and to actually build strength and agility and fluidity of motion and ability to stay functional. And, and part of this is responding to the fact that so many people who have come to me over the years with fibromyalgia, with chronic pain from this or that issue, that whole disability thing is one of those terrifying boogeymen. Like, I'm getting worse and worse. Am I going to get disabled? Am I going to have to live in a nursing home? Are people going to have to take care of me? And it's terrifying. And so this is in part to help people heal and feel better now in a month, 2 months, 3 months, but also maintain that over time. So in summary, responding to those questions, is this program already built or is it going to develop? Sure, it's going to develop. That's what it's really all about. There's going to be some content there, but I'm building this program around the participants. And so we're going to be in a laboratory about how to optimize delivery of these teachings, these techniques, these tools, and these healing possibilities, and how to make that work in an online digital space, how to do it with an online supportive community. So it's going to develop and evolve over time. And then in response to the question of how long does the program last, it's really up to you. What do you want to gain out of it? Do you want to come in and up your quality of life and function for a few months? Do you want to keep going over time and maintain that and build over time as you move through life and age and all of that? It's really up to you. It's meant to be both. And so that's why it's meant to be affordable and available and effective. And that's what we're trying to create here. Taking sign-ups until the middle of next week. Then we're going to close and we're going to work on building the best program possible. And then we're going to open up again, probably 3-6 months from now. And it's going to be a whole different ball of wax. It'll be more expensive, but you get the choice. Choose whether you want to jump in on the ground floor, help make it great, and get that founding members price for as long as you stay a member, or wait and come later after it's completely awesome. So anyhow, I'm excited about it. If it resonates with you, feel free to send me a PM if you want some more information or if you want to know how to join. And that's how we roll. Thanks for watching and listening. Take care.